Agenda item number 5 is the award of Centers for Disease Control and Prevention Community Transformation Grant, an update on CDC Communities Putting Prevention to Work grant. Dr. Huang, I thought I saw him here. There he is. I'm not sure it's on. Can you tap the little base, touch the base of the microphone?
And the slides? Okay, here we go. Good afternoon. Appreciate the opportunity to give you an update on what we've been doing with the Communities Putting Prevention to Work grant, as well as our new Community Transformation grant. Just starting out, we've talked about some of these data before. If you look at the data from Travis County, cancer is the #1 killer. Heart disease is second. Fourth is stroke, and chronic lung disease is fifth. So about 4 of the top 5 are related to tobacco use. Translate that down. This is actually Texas data, but it's over 24,000 deaths due to tobacco each year in the state. We estimate almost 600 in Travis County. And I also put on this slide because it also shows obesity, and these are the preventable causes of death and in our state. So it's tobacco, obesity, the top ones. But again, we always say tobacco kills more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined, and it's entirely preventable. So with our Communities Putting Prevention to Work, I know we've briefed you in the past about that grant. We had a lot of success in the last year and a half, and you think back to where we were a year and a half ago and where we are now. Some of the key targets that we've been working on are in the healthcare settings, schools and university, media, work sites, and community, and I'll talk about some specific areas where policies have already been implemented. But for instance, in healthcare, we've been working with the ICC, formerly the Indigent Care Collaboration, or Indigent Care Collaborative, now I think Integrated Care Collaboration, but it's all the indigent care providers in the community have been, and also Seton, have been working on electronic health care record changes, system changes to all of these settings so that every patient who comes through their clinics is assessed for their tobacco use status and referred to the cessation resources. We funded Seton so that there's a community cessation resource that's available to anyone in the community for free. They can even get free nicotine replacement. We've worked with schools and universities. Houston-Tillotson adopted an entirely tobacco-free campus policy. ACC just announced that they're going entirely smoke-free effective in January of this coming year. We've had a lot of other work going on. I know there's efforts at University of Texas, other universities and schools in the community. We've had a lot of media campaign that's sort of reflecting the messages that I've already been talking about, the high burden of tobacco-related disease in our community. We've been working with work sites, the Mayor's Fitness Council, working on, again, promoting these tobacco-free campus policies because we know they're very effective. For instance, Dell Computer has shared with other employers that, as a result of their tobacco-free campus policy and offering cessation services, their smoking rates among their employees went down from 13% down to 3%. Austin Travis County Integral Care, another work site where with the population they serve, very difficult to adopt these policies, but they've been successful, and their own staff rates of smoking have dropped from 29% down to 13.9%. So very, successful, and the people really like it. Dell has shared that you can expect it's noisy for the first couple months, but after they're implemented, they started getting emails from the people who had been most vocally opposed to the policy saying, you know what, I wound up quitting smoking and it, quote, changed my life. Thank you for doing this. So again, a lot of successes in those areas. With community, we're getting a lot of policies. You've already, I know the Capital Metro Transportation Board just adopted tobacco-free bus stops last week. We hope that there might be some more teeth put into that so it can be enforced even further. I know that the parks, it's coming up next month, that the parks are going to be proposed to be smoke-free. They already actually have been smoke-free for the last several months with the burn ban and that being a permanent thing. So again, a lot of community changes, social norm changes that really help protect the public in our community from secondhand smoke and tobacco. Again, these are just some of the policies that have been already adopted in our community as a result of CPPW. So tremendous success with this program. And the success of CPBW has really positioned us well to implement the Community Transformation Grants. And so the Community Transformation Grant Program, it is authorized under the Patient Protection and Affordable Care Act, known as the Healthcare Reform Bill, and its really purpose was to create healthier communities by building capacity to implement evidence and other practice-based policy, environmental, programmatic, and infrastructure changes, and supporting implementation of interventions in 5 strategic directions. And so it builds on what we've done with CPBW on tobacco-free living, but also then is expanding it to active living, so physical activity and healthy eating, and high-impact evidence-based clinical and other preventive services to address hypertension and high cholesterol, social and emotional wellness, and healthy and safe physical environment. But the guiding principles of this are to maximize the health impact through prevention, to improve health equity, and then also to use and expand the evidence base for local policy, environmental, and infrastructure changes that improve health. And I want to just, when we talk about the policy, environmental, and infrastructure changes, what we're talking about, and the reason they're focused on that, and I think it's a great focus, is because it's to overcome, quote, the stickiness problem. And what we talk about with the stickiness problem is, for instance, this is a study that was in JAMA looking at exercise participation. And so they looked at trying to get people to exercise more by long bouts of exercise, short bouts, or short bouts in home treadmills. And you can see during the first 6 months, there was good, all the 3 arms of the study showed increases in exercise participation. But what do you think happened after those first 6 months? Does it go up? Does it stay the same? Does it go down? It goes down, you know? And you see that in other studies. Here was a self-help versus commercial weight loss programs. And again, the self-help and commercial weight loss, both during the first 6 months, they show effectiveness. But then what happens as time goes on? It goes back to the norm. And so by focusing on the policy, system, environmental changes, then it creates the change in the social environment that has the long-term impact on these behaviors. And that's where, again, with tobacco, the policies and changing the social norm of our community are very effective. And the same sort of application to physical activity, nutrition, and obesity. So this is a slide from Dr. Tom Frieden, the director of the CDC, showing the factors that affect health. At the base of this pyramid are the socioeconomic factors. Poverty, education, housing, inequality are the things that are the foundation for affecting health. Then as you go up the pyramid, changing the context to make an individual's fault decisions healthy. And we talk about making the healthy choice the easy choice. So again, it's like smoke-free laws, tobacco taxes, trans fat and sodium reduction. Then you move up and long-lasting protective interventions such as immunizations, brief interventions, or cessation treatment, or colonoscopies. You keep moving up this pyramid, then you get to clinical interventions like treatment for high blood pressure, high cholesterol, diabetes. And at the very top are some of the traditional things that we've done, just health community counseling and education, telling people to eat healthy and be physically active. But again, if you can change the things further at the base of the pyramid, that's what has the longer-term effect. And it also has the largest impact as you go down the pyramid. So these are some of the things that and this is actually a CDC slide for a Community Transformation Grant, showing the type of things what states and communities can do to prevent obesity. And these are the exact type of things that we proposed in our proposal to the Community Transformation Grants. And so with schools and child care, you can see sort of doing increasing exercise and physical activity in the classes, reducing screen time, increasing walking and cycling to school, at work sites, work site wellness programs, in communities, increasing access to healthier food, eliminating healthy food deserts, in healthcare, BMI measurement, making system changes in the healthcare setting like we've already done with tobacco. So every patient is systematically addressed for one of these problems and followed up. And so with our Community Transformation Grant, out of 244 applications, we were one of 35 communities selected for implementation level funding, and that's the higher level funding. There were an additional 26 communities funded to receive just smaller level capacity building funds. We're receiving a little over $1 million for year one. It's a budget of a 5-year grant program, but it is important to note that years 2 through 5 are dependent on the continuation of funding for the Affordable Care Act. And so some of the types of things, again, that we proposed, incorporating into the city's 30-year comprehensive plan, the Imagine Austin plan, to develop and implement a healthy Austin code, And so as the street design, incorporating that it promotes bicycle use or wide sidewalks and physical activity and connectedness to the parks and to the transportation systems, all these things to promote physical activity just being the way people get around in our community. Increasing the number of neighborhoods in Austin that have access to grocery stores or markets selling high-quality fresh fruits and vegetables. Promotion of urban farms, community gardens, things like that. Promotion of tobacco-free living and protection from secondhand smoke. Increasing the availability of healthy foods sold or used by restaurants, schools, work sites, healthcare facilities. And then clinical system changes, again, like we've been doing with some of the ICC providers to change and improve outcomes related to high blood pressure and high cholesterol. But again, the same partners that we've been working on with CPPW, we're well positioned to then expand those interventions and the type of strategies to address physical activity, obesity, and hypertension and cholesterol. So that's it for the update on that. Again, we're very pleased and fortunate to get this. Want to also build on some of the things that Councilmember Morrison's been doing with obesity and the obesity strategic plan that we have for our community. But it's a great opportunity.
Thank you, Dr. Huang. Any questions, committee members? Councilmember Morrison.
Thank you, and congratulations to you and your staff and all of us for receiving the grant. It looks like exciting opportunities. One of the questions that occurred to me is in terms of working on addressing work sites and corporations and all, have you mainly at this point been working with large companies as partners? And I'm wondering, it seems like biggest bang for the buck. And have you, or is there a plan for reaching out to sort of smaller companies, because we have so many people that are employed by small local companies here in Austin?
Sure. We've actually been trying to do both. Again, we've been doing a lot of our worksite activities through the Mayor's Fitness Council, but also had reached out with the Hispanic Chamber of Commerce. They actually co-sponsored, for instance, with CPPW, a session where we brought down the former Surgeon General to talk about worksite tobacco policies and try to get other Hispanic-owned businesses to participate. Again, the Mayor's Fitness Council includes both large and small employers, and we're always looking for other partners to try to reach both the large and smaller employers.
That sounds, I know that we have good connection at the city with several minority chambers, as well as the Austin Independent Business Alliance, which is sort of a chamber for small businesses. So if you haven't tapped into those folks, that might be another opportunity.
Yeah, we're definitely looking for more opportunities. And what's great is that more and more employers are recognizing the importance of having a healthy workforce, and how some of these type of things can really not only help them to have a stronger, healthy workforce, but also to cut down on their healthcare costs, lost productivity, things like that.
And mentioning that, I remember a few years ago talking to some of the folks that were involved in looking for businesses to relocate here, good businesses to relocate here, and having that conversation. And it wasn't on the radar at all at that point. But the fact of the matter was that businesses do look at the health of the community, because they know that that's going to have a lot to do with their workforce costs. So it's an exciting opportunity. Thanks.
Thanks, Councilmember. Dr. Huang, I wanted to, just mention a couple of nonprofits that I think we could partner with and not have to reinvent the wheel as it relates to communities. And actually, Shannon Jones will know this person very well. He's done a lot of collaborative work with her. Her name is Toni Tipton Martin. I know that Councilmember Morrison has talked to her. She has a nonprofit called SANDE, S-A-N-D-E. I'm not sure what the acronym stands for. But the concept is, she goes into the school system and teaches kids how to cook healthy but delicious meals, and try to get them to take that home and educate the parents. What they're looking for right now, and what we've started a discussion with, is to make the model self-sustainable. They have to have a certified commissary to be able to prepare this food, to sell it into the community, to create a more sustainable model. You can't cook food for public consumption in your own, as you all know, in your kitchen. And so we're looking at trying to build a facility in East Austin where she brings the kids from the school to the kitchen to prepare the meals in a certified commissary, so that we can take it out to the community and not only educate them about the health benefits of healthy eating and cooking, but providing the meals and creating a funding mechanism to create some sustainability. So that's one nonprofit that I'm aware of that's really doing some innovative work that could potentially be a great partner.
Sure. Sounds great.
The second one is Urban Patchwork. Urban Patchwork is a local nonprofit that literally will go into your front yard and or backyard, whatever you choose, and they will farm your front and backyard. And they will take the produce and bring it to farmers market, and that's how they create their funding mechanism. But at the same time, whoever owns the property and allows Urban Patchwork to use their front and backyard as a farm, you get to take the produce into your house and use it and eat it whenever you want. A lot of folks, a lot of moms, single working moms, a lot of folks, both parents working, they don't have time to farm and garden. They'd love to, would love to try to get a little bit healthier, but it's expensive. There's not access to it in certain parts of our community. And two, it takes a lot of time and energy and effort. Something like Urban Patchwork could help reduce that burden and create the options and opportunities for those folks to have some really locally produced and quality food products for them and their families. So those are just a couple of groups that come to mind that I think could really become good partners in an effort like this.
That sounds very interesting. Yeah, I mean, I know we've also talked to the Sustainable Food Center where they've done farm-to-school programs and getting the kids at the schools involved in growing the gardens and having their own community garden there. And so, yeah, those sound very interesting.
Okay. Councilmember Riley.
I would just add that even for those who don't who don't own homes where they can plant gardens in the yards, there are nonprofits who will even come along and do box gardens right there. So a lot of renters can actually have the opportunity to make use of gardens and be able to grow their own food as well. So, and there are local nonprofits focused on that, so we could work on that as well.
Great.
Doctor, I want to thank you for the presentation and for all your work on this. And I just had one other question, and it relates to the first bullet point on your action items that were on the last slide. You mentioned that the proposed activities to be funded by this grant include incorporation into the Imagine Austin plan to develop and implement a healthy city code. Could you elaborate on what that would entail?
Sure. Well, we've been working closely with Planning and Development Review, and I know it is, one of the priorities in the Imagine Austin plan for a healthy Austin. And again, I think the concept is that some of the future code development that do promote future developments and also, I guess, renovation of existing developments, that whether it's the street design, promote physical activity with the width of the streets and the width
streets.
Complete streets. And there are other types of just less cul-de-sacs, more connectedness, again, to parks and things which promote both bicycle use and walking. And there are other code type of policies that can be implemented to promote, I think, healthy eating type of things. And so I think it's exploring those. I know they've got a lot of expertise with the details of what would be included in something like a healthy code.
And I think all the things you mentioned are consistent with a lot of other things I've been hearing during the course of the development of the comprehensive plan. So I really appreciate your support on that.
Absolutely.
Thanks.
Councilmember Morrison.
Thank you. I want to follow up on what both my colleagues here have said. In terms of the Healthy Austin Code, I know that, in fact, someone sent me a copy, I think, is it Boulder or somebody? There's some other wonderful models out there already, and I'd be glad to share them with you. But with regard to what Councilmember Martinez brought up, it reminded me in terms of a comprehensive plan. There are other issues that we need to be thinking about for a healthy city besides our code. Bringing up the idea that we need a commissary, like a community accessible commissary, is a piece of infrastructure for a healthy city. Another issue that came up for me recently in terms of having a healthy city is, of course, promoting local agriculture, but that's limited by having accessible cold storage so that they can actually build some volume and all. So that might be a next level thing to look at in the comprehensive plan, is looking at infrastructure for a healthy city. as well.
And it was great. Actually, Garner Stoll with Planning Development Review went with us to the kickoff meeting for Community Transformation Grant, and I know another Carol Haywood with their staff is going to be going to our leadership team meeting in Atlanta in the next couple of weeks also. So
Great. Yeah, it's really a lot of great opportunities and exciting things.
Dr. Huang, thank you so much. Really do appreciate all your efforts
Thank you.
in this regard. Thank you. Okay.